Assalamualaikum and good morning everyone. So I am Teacher Ain. Today I'll be presenting about ADHD or known as Attention Deficit Hyperactivity Disorder. ADHD is regarded as the one of the most common mental disorder or one of the most common childhood neurobehavioral disorder, which is heterogeneous behavioral disorder of uncertain causes that always evident into children, which affects 5 to 8% of children, mostly prevalence to the boys than the girls, according to the WHO. ADHD also typically persists into through adolescence and for some into adulthood. ADHD will affect a child's learning and their functioning in daily life, where they will exhibit inattention, where they're not being able to focus. Secondly, hyperactivity, where they're shown an excessive movement that is not appropriate to the setting, or an excessive fidgeting, tapping, or talking. They will also exhibit impulsivity, where they will acting hastily without thinking, and in a way they may have high potential for harm themselves or others. The first features of ADHD is inattention, where the child is not being able to stay focused. Inattention is demonstrated by the failure to attend to details. They will have difficulty to sustain attention during play. They will have inability to listen actively to instruction or conversation, and they also have difficulty in organizing tasks and avoidance of tasks that require a sustained attention. Children with ADHD also will get easily distracted and forgetful in their daily activities. Second features of ADHD is hyperactivity. Hyperactivity is shown by an excess movement that is not appropriate to the settings, or they will show an excessive fidgeting, tapping, or talking. The examples of hyperactivity is like frequent fidgeting, the inability to sit when remaining seated is expected, such as in classroom. They will have difficulty to playing quietly. They will show an excessively talking about things that random things, and they will be in constantly on the go. Thirdly is impulsivity. Impulsivity is an acting hastily without thinking and in a way that may have high potential for harm themselves or others. Impulsivity can be seen in the inability to wait for one's turns and a frequent and incessant interruptions and blurting out of answer before a question is asked. They also will show a low frustration of tolerance, have an sleep disorder, and frequent demands for attention. Children with ADHD are also at high risk of injuries, where they're associated with increased risk-taking behavior and impulsivity. The symptoms of ADHD vary in a degree of impairment, the frequency of occurrence, and the pervasiveness across setting. It must be occur often to distinguish single symptoms from typical behavior which is observed in children, and it must be observed in across multiple settings such as at schools, at play, during their daycare, and also at home. The symptom also must be persist for at least 6 months to a degree that these symptoms are maladaptive and interferes with all occupational activities such as self-care, their academic performance, and their peer relationship with others. The etiology of ADHD or the causes or the exact causes of ADHD are not clear. Some factors may possibly have a role, such as child's diet, neurology, genetic, and neurochemical imbalance. One theory that persists in a popular literature is that ADHD is related to food allergies or food additive and the amount of sugars in the child diet. The National Institute of Health and IHH concluded that there is no evidence that diet is responsible for the onset of ADHD and that only in a fraction of children with ADHD is a restricted diet efficacious in reducing symptoms associated with this disorder. In neural imaging studies, a significant decrease in brain activity in the frontal parietal lobes, which inhibit impulsiveness and control attention, has been demonstrated in adults with ADHD. However, the primary cause of this decreased activity is still unknown. Studies of the heritability of this disorder are perhaps the best support that researchers have for linking ADHD with a neurobiologic etiology. It is clear that ADHD runs in families, and this may be one of mechanisms underlying ADHD symptoms. Siblings of children diagnosed with ADHD are 5 to 7 times more likely to be diagnosed with ADHD as are children from unaffected families. The neurochemical research into potential causes has failed to identify a single neurotransmitter that is responsible for the clinical deficits in ADHD. However, medication that influence neurotransmitter functioning are effective in treating some aspects of ADHD, leading researchers to believe that a neurochemical cause remains a viable theory. The selective availability of dopamine and norepinephrine are both candidates for a significant role in this disorder. Other factors that may be possibly play a role in ADHD is firstly, they have a significant traumatic experience. Secondly, the child being born prematurely. Thirdly, the child might have a brain injury. Fourthly, they may have exposure to environmental toxins at a young age where is such high level of leads. And fifthly, the mother might be smoking, might be using alcohol or having extreme stress during the pregnancy or being exposed to lead during pregnancy. ADHD cannot be cured so that it's stopped completely, but treatment can help to control the symptoms and improve the child's functioning in everyday life at home and at schools. A treatment plan needs to be assessed by a specialist, and carrying out the treatment plan requires good communication and teamwork between doctors, parents, and school teachers. Some intervention that can be done to treating ADHD is by medication, and secondly, by behavioral management. Medical intervention strategies include stimulant pharmacotherapy, such as amphetamines and methylphenidates. Pharmacotherapy allows 9 out of 10 affected children to be more focused and to be more successful at school, home, and play. There is no evidence that prolonged use of stimulant drugs is addictive, promotes addictive behavior in adolescents, makes children high or jittery, or sedates the children. The realistic side effects of these drugs include weight loss, loss of appetite, interrupted sleep patterns, and some children have a slow growth. Pharmacologic treatment seems to improve overactivity, attention span, impulsivity, and self-control, compliance, physical and oral aggression, social interaction with peers, and academic productivity and social and accuracy. Rarely, however, are medications alone sufficient to allow a child to function in most settings. Deficits that seem to persist are those in reading skills, social skills, learning, academic achievement, and antisocial behavior. Consequently, one or more behavioral interventions are typically needed. The most frequently recommended therapies include cognitive behavioral therapy (CBT), behavior modification, educational interventions, social skills training, and also psychotherapy. Although the definitive efficacy of any one strategy has not yet been determined, it is clear that a consistency in response in all of the child settings, the environmental adaptation, and counseling to alleviate low self-esteem contribute to improvement in learning and attainment of social skills. School-based occupational therapists often receive referrals for children with ADHD and provide a variety of strategies to the classroom to improve attention and focus. Examples include modifying the classroom environment, social skills training, self-management techniques, and intervention to enhance sensory modulation. In conclusion, parents need to remember this has not happened to your children because you have not been doing a good job as parents. Do not blame yourself and be proud of yourself. Thank you for listening, and I hope you can get useful knowledge from this presentation. Bye bye.